everyone, this is Hannah. I have today's Rocket Miner COVID-19 daily update. Today in Wyoming we have 332 confirmed cases with 121 probable cases and 279 recovered cases. Now, I've heard a lot of people talking about how we can do the math with these numbers to see how many active cases there are. Unfortunately, I've also seen a lot of people that aren't doing that math correctly because they're just taking the confirmed cases and subtracting the recovered cases, but the probable cases are important too. We have to remember to add those in. So when you add the 332 confirmed with the 121 probable and then subtract the 279 recoveries, you have 174 active cases. And that's important to include the probable cases because the recovery number is also including probable cases in it as well. So we need all of those numbers together to look at how many there have been, how many are currently active, how many are recovered, and just keep all of those things in mind. And keep in mind too that a lot of health officials have said that this is a good indication, but it's not necessarily a completely accurate indication of the actual cases in Wyoming, just because of the problems with limited testing or people who may have gotten it but not been tested and not confirmed. So there are more cases out there than what these numbers actually indicate, but this still gives us a good idea of where we're at and where it's holding steady. It's going up less, which is awesome, but we need to take all of these different factors into consideration when we're looking at the numbers and thinking about the cases. Today, the biggest news was that Governor Mark Gordon gave a press conference together with State Health Officer Dr. Alexia Harrist, and in their press conference they kind of outlined what are Wyoming's plans going forward, where are we at, what are we doing as we go into the next month, as we look at easing off on some of the orders and restrictions. You can go watch the full press conference. It's up on the PBS Wyoming Facebook page and YouTube channel. You can watch the whole thing. It's about an hour long. Definitely encourage everybody to watch it just to be totally informed, to know what's being discussed and what's going on. But I'm going to give you the kind of Cliff Notes version and break down some of the highlights and the main points from the press conference that they discussed. The governor started the press conference by acknowledging the 7 deaths that we've seen in Wyoming from the virus. And he said that these deaths show us just the severity of COVID-19 and how insidious it can be, and it needs to be taken seriously. Then the main idea for the press conference was, as I said, to kind of outline what the plans are, where we're at, and what we're looking at for moving forward, and what our kind of transition plan is going to be. The governor said, "We are building a plane as we fly it, and with your help we'll keep it in the air." There's still so much difficulty and uncertainty just because this is such a completely new situation. So all of our leaders and people making these decisions are doing the best they can to make the best, most informed, most helpful decisions, but they don't always have all the details or all the plans right away because they're working with things as they come. So the governor is kind of reminding us of that, and they're giving us as much as they can, but they're still working on making this a process and making sure it's something that will actually work and be beneficial for our state. He said that we're going to be taking slow, incremental, and thoughtful steps on how to ease the restrictions in Wyoming. He said that this is going to have to be a balanced approach that is driven by 2 things, both by the concern for public safety and also the concern of allowing our people to get back to work and keeping our economy going. He definitely is concerned about both those things and wants to find that balance. He said that we'll need to relax restrictions slowly and get ready for a new normal of business. He said that this will be easing into it. It will be a thoughtful process that will be measured with positive progress. And he said multiple times and continues to repeat that we want to be driven by data, not by dates. It's not a matter of we know for sure that we'll go back to normal on this day. We can't know that. We need to see how the situation develops, and that's what they want to do and what they want to keep working on. So he clarified that the current health orders that are still in place are still going to extend to the end of the month, to April 30th. There won't be any changes on that. But then those orders will be modified as we go into a new phase in the next month, and there will be an easing of health orders with that. And for now, they're going to have a phase that will extend to May 15th. And so we'll see for that first half of May as we start to ease back some of the orders and restrictions and see what effect that has. And they said that more specifics of their plan are going to be released probably within the next week. And also he clarified that for Wyoming, individual counties will be able to basically make their own decisions and work with their own health officials to decide what is best for that county based on how hard the virus has hit there, what the current state of their numbers and resources is. So there will be the orders for the state, but then that will also vary by county most likely. The governor said that businesses that will likely be allowed to reopen with modifications in place soon will include barbershops, cosmetologists, and gyms. He said that those will be some of the first ones to reopen, but of course there'll be different protocols and safety procedures that they'll have to go through now to be open. He said he knows that there are lots of questions about bars and restaurants and businesses like that and when they'll be able to open. And he said they're still working on plans to address that and decide what's best to do. He said it is critical that we be measured in our approach, particularly given the associated health risks associated with these businesses. So since there are potentially more health risks with things like restaurants, they need to be careful in considering how they plan to reopen those. The governor also pointed out that the considerations for Wyoming extend across state lines and we are impacted by the other states around us. So he said that he's been working very closely with the governors of all of our bordering states and is communicating with them and working through what they're doing, what we're doing, and how we can work together as we make these plans. The governor also made the analogy that he said we're living in Wyoming, we know what it's like if you plant your garden too soon before the last frost or snowstorm, and then you lose the whole garden because of that. That's something that people in Wyoming are very familiar with, and it's kind of a similar thing where they don't want to reopen everything so soon that we have this virus come back even worse than it was, and we lose all the progress that we've made with these orders and restrictions so far. Dr. Alexia Harrist also spoke during the press conference. She started by saying that she sympathizes with how everyone is just growing weary of the toll that this virus is taking on our lives. She said she understands that, but she wants people to know that it's not over yet. It won't be over April 30th. We won't just be able to go straight back to normal. And again, the same thing the governor stressed, that if we don't make thoughtful and careful choices now based on information, then we're going to face a much worse risk with the possibility of this virus coming back worse than it was. They shared an image that's a graphic with different dashboard metrics about our state's response to COVID-19 and where the numbers are at and where the concern level is at. You can see that in a story that's on our website right now. It's also on the governor's Facebook page, and it's in the press conference video. It gives a lot of different things, the different metrics that are being looked at and the data that everyone's considering as they make these plans, which includes the new cases, the percent of cases attributed to community spread, the percent of all tests that are positive, total COVID-19 admissions reported by hospitals, total hospital bed availability, and total ICU bed availability. So this is the data and the numbers that they're looking at and considering as they make these plans to see where we're at, how the virus is progressing, how we're able to respond to it. They had different colors on those to show whether they were improving or concerning or stabilizing, and none of those were actually improving yet for Wyoming. Several of them were stabilizing. A few were still concerning. such as the percent of cases attributed to community spread was one of the numbers that was still high enough to be concerning. But a lot of them are stabilizing, so we are still moving in the right direction, but there's still a lot to be considered there. Dr. Harris noted that there have been 54 total hospitalizations in Wyoming, and there are 16 current COVID-19 patients that are in the hospital. She also addressed the testing capacity and how that's been a concern with having limited tests available and not being able to start as early as we wanted to, and how this influences the numbers, how because we haven't been able to do as many tests as we would like, there are more confirmed cases out there that we just aren't aware of yet. But she said that there is good news and there's progress in that area. The public health laboratory has been ramping up their capabilities and their supplies are improving. So before they were limited on the testing to just the priority groups that they were able to test, but now they're actually able to accept samples from more patients outside of those groups. So more samples will be going through the state lab as well as the private labs that have been doing testing and everything else. So hopefully the testing will keep going up. She also stressed the importance of everybody wearing face coverings when you go out into public settings, both now and moving forward into the future, and said that this is in addition to the social distancing of being sure to stay 6 feet away from people. So even as restrictions start to ease, we still need to be taking a lot of these social distancing safety precautions. And Dr. Harris stressed multiple times through the press conference that this is a virus that anyone can get, anyone can pass to anyone else, and anyone can die from. She said that it is a fact that you can be asymptomatic, you can have the virus without even knowing you're sick, and still keep passing it to other people. So even if you think you're fine, you go out and do things, you could pass it to somebody else who won't be fine, who could potentially die from it. And we need to remember how serious it is, how quickly and easily it spreads, and how deadly it can be. And we just need to keep the devastating effects of this virus in mind so that we're taking it seriously and we're taking the precautions that we need to. Also during the press conference, the Superintendent of Public Instruction, Jillian Ballo, spoke about the schools. She noted that the health orders and the guidance for education that's in place right now gives an opportunity for schools to be able to provide limited in-person instruction for students with the greatest need. So for like special education students or students who need that in-person teaching more, there is opportunity for schools to be able to teach them in person and give them the attention that they need with proper social distancing and sanitation and safety procedures. So she was encouraging schools to look into that as an option moving forward, to be sure that we're giving the attention to the students that we need to give it to especially. And she spoke more about schools as they consider reopening for the fall and how they need to go through that process. In closing, at the end of the press conference, the governor shared the quote that is attributed to Winston Churchill, that those who don't study history are compelled to repeat it. And Governor Gordon pointed out that if you look at Wyoming's history in 1918 with the Spanish flu, the governor of Wyoming put the same kind of restrictions in place then that we have now, the same kind of closing businesses and public spaces, but the people of Wyoming didn't want those restrictions and they started to push back against them. So Wyoming started opening its businesses again. And the governor said within a few weeks, suddenly the Spanish flu descended on Wyoming in an unprecedented way. So we're in the same kind of situation now where we don't want to repeat history. Back then with the Spanish flu, they pushed back too soon. They went back to normal too soon. And it did have horrible consequences where the flu came back in. I've been reading things about the Spanish flu and it's really interesting to see how history kind of repeats itself and to look at how that situation was handled and how it came in waves over a couple of years, which is a scary thought because none of us want to think about going through this for a couple of years. But as the governor was saying, it's something that we just need to find a new normal and a way to adapt and a way to address these things and to be safe. And with the Spanish flu, there are a lot of cases in a lot of cities where you can see that same thing, where they had parades too soon or they tried to open their businesses too soon, and then the flu just spiked again and more people died. Millions of people died from the Spanish flu, more than from the war that was occurring around the same time. And I think we need to carefully consider history and the lessons that it teaches us about how we handle the situation we're in now. But the governor said that he has been relying on the people of Wyoming to have common sense and to be responsible and to care about not wanting to spread this disease to their neighbors or anyone else. And he said that we have been successful and that he thinks Wyoming will continue to lead the nation as we start to adapt to this new normal and new way of doing business and doing life that may have to continue for longer than we initially thought, but we can find ways to adapt and to move forward. The governor said Wyoming will be a leader, Wyoming will be successful, and it is absolutely essential that we not have a recurrence of this COVID disease. So those are the highlights from the governor's press conference, just as we think about how we're going to move forward in the next few weeks and how we'll adapt and find ways to keep going with caring about Wyoming's people, which means that we care both about the economy and the jobs, but we care about people's health and keeping people safe. So as we all work on finding that balance together, let's just keep finding ways to go forward. Thank you for listening, and keep checking with us for more updates, and have a good night.